Okay, so many thanks for the opportunity of presenting our study on occupational COVID hazards in Austria, which is actually a perfect follow-up to Thomas's wonderful presentation on gender, age, and COVID now. So this is a perfect fit, so to say. So Raya and I are focusing on the situation in Austria, and we ask if women really are more exposed to the coronavirus at work, as this was one of the hypotheses also in Thomas's presentation. So I should actually also make a full screen. Okay. So, I'll start off with some theoretical background, first on COVID-19 as an occupational hazard, and secondly, I'll talk a little bit about theories of risk perception more generally. Then I'll summarize the available empirical evidence on these two issues before I will eventually present our survey data and our results. So our focus in this study is on people's perception of the risk of contracting COVID-19 at the workplace. And we ask which sectors of the economy are associated with a comparatively high perceived risk. Does the perceived risk vary with the age and qualification level of employees? And finally, are women and migrant workers more at risk of contracting COVID-19 at work? So first, a bit of theory. So the Central Statistical Offices of the US and the UK have defined high-risk occupations based on the types of activities that are involved in carrying out different jobs. So the focus here in this literature is on two dimensions. So risky occupations are defined as those that involve exposure to disease more generally, not specifically regarding COVID. And secondly, risky occupations are those that involve close proximity to others. Which makes a lot of sense. So based on the analysis of typical tasks within occupations, the statistical office then came up with this two-dimensional classification of jobs. So they identify, for instance, health occupations as high risk due to the high degree of exposure to disease and the fact that these jobs involve very close contact with others, often within arm's length, sometimes even touching. Another group of workers was identified as medium risk, so to say, relatively high risk, but not as high as in hospitals. So these would be elementary occupations in the service and catering industry, in bars and chefs and tourism and so on and so forth, and as well as sales and retail staff on the shop floor. So these are also high risk occupations in theoretical terms. Occupations on the bottom left, so to say, so the low risk occupations, the ones at the very left, they include artists and agricultural machine drivers. So people sitting on agricultural machines are apparently those who have the least contact of all jobs. Other jobs in this lower left angle are legal professionals, professionals in HR and marketing, also economists and statisticians, as you may be pleased to hear, people working in IT, administrative occupations more generally. Okay, so if we look at the composition of occupations identified as high-risk occupations in this theoretical exercise, we find that in many of these occupations, women make up the majority of workers. In many of these occupations, persons with a minority ethnic background are overrepresented, and we also find low-paid workers to be overrepresented. In fact, it is those high-risk occupations that have been identified as being essential during the pandemic, so essential for the maintenance of critical infrastructure, such as occupations in healthcare and safety, the food service industry, and public transportation. And these jobs are often done by low-paid women with a migrant background, if you think of nurses, social workers, care workers, shop floor retail staff. Some of these jobs are also done by low-paid men, also often with a migrant background, if you think about security guards, taxi drivers, coach drivers, and so on. Of course, some of these essential jobs are also done by more highly qualified workers, if you think about medical doctors. However, on average, it's really the low-paid individuals with migrant backgrounds who are massively overrepresented in those essential jobs that are most at risk during this pandemic, so to say. So, based on this theoretical account, we may expect working women and persons with migrant background to face a greater risk of catching the coronavirus at work compared to native men. So what's the empirical evidence on this? There is not much yet, actually. So one rather interesting study comes from the Office for National Statistics from the UK, which has looked at about 5,000 COVID-19 related deaths and looked at these deaths by occupation. And this study suggests that these deaths were actually concentrated in quite a limited number of occupations. So this piece of empirical evidence largely corroborates the theoretical accounts that I just mentioned. However, if we seek to learn more about COVID as an occupational hazard, there are at least two important caveats to studies on COVID-related death. First, such studies do not tell us much about infection risks, of course, given that some population groups may be equally likely to catch the coronavirus, but more likely to die from it. So in this study, there is very likely a bias towards male death in male-dominated occupations. A second caveat here is that, of course, if we link COVID-related death to the occupation of people, we don't really know if the disease was actually contracted at work. So we don't have a direct measure of the occupational hazard of disease contraction. We may actually be measuring non-work risks that are associated with the job holders of occupations that are defined as high risk. So we may measure something like living situations, housing situations, regional characteristics, much more than occupational hazards by doing that. Secondly, apart from mortality studies, there are only a few studies that have managed to link actual corona or COVID infections with occupations. So most of them are also done by statistical offices. But of course, caveat 2 applies also to this kind of studies. So even if we know what jobs people have when they get infected, we really don't know if those people have been infected at the workplace or elsewhere. Okay, so also Tomasz and colleagues were looking at infection rates, as we just heard, and they show that among people of working age, more people than men get infected with COVID. And they conclude, or one of the hypotheses in this nice paper, is that this gender pattern emerges because women are more likely to work in professions that are particularly exposed to the coronavirus. So their study did not include Austria, but just to show you very quickly, this pattern also applies here. So on average, a similar number of men and women have been diagnosed with COVID in Austria, but in the core working age, more women than men got infected. So now in the study I'm presenting today, we ask, is this age pattern of infections really driven by the fact that women are more exposed to the coronavirus at work? So in order to circumvent caveat 2, that also applies to this study, of course, namely that we don't know where people got infected, we use survey data in the aim to give at least a tentative answer to the question that was raised by Tomasz and colleagues. Okay, so if we want to learn more about people's risk of getting infected with the coronavirus at work, ideally we would like to have data on corona infections together with information on people's jobs. And we would also need information on where people got infected at work or elsewhere. Such data is, of course, not really available on large scale. So our approach is a focus on the perceived risk of infection at work. So we are asking people to estimate their own risk of a COVID infection at work. This approach has an important advantage, namely our outcome measure is specific in its focus on infections at the place of work. So caveats 1 or 2 don't apply here. The approach has, of course, a disadvantage, the subjectivity of risk assessment. So we need to assume that we are dealing with cognitive rather than emotional risk assessment, risk assessments that are associated with the actual hazard at the workplace. So our aim is to find out how women and men perceive the risk of infection at work and what role the workplace plays for potential gender differences. Before I describe the study in detail, a quick mention of the theoretical background on risk perception. So there is a large body of scholarship on gender differences in risk perception, which tends to find that women tend to worry a bit more than men. They tend to estimate risk to be a bit higher than men. Potential explanations for such a pattern include women's socialization and their enactment of traditional roles as mothers and nurturers, and so on and so forth. Moreover, risk research has revealed the so-called white male effect, whereby white men report on average lower risk perceptions than women and racial minorities. Others have suggested that it would be more appropriate to rename the white male effect into a social inequality effect, because it's social privilege rather than ethnicity or gender which explains differences in risk perceptions. Okay, so some recent evidence on gender differences in risk perception, specifically regarding COVID, has recently been published in the Journal of Risk Research. So this study finds that in a pooled sample of 10 countries, males on average perceive less risk from a COVID-19 infection than women. But the difference was not large, and more importantly, when they looked at the gender difference country by country in these 10 countries, and the sample sizes allowed this without any problems, the gender difference was only present in 3 out of 10 countries. So in most countries, women worry no more about COVID than men do. Okay, so our study on the perceived risk of contracting COVID at work is based on a survey data from Austria. This is a representative survey that was carried out in June using a combination of online and telephone interviews. It was a multi-purpose survey covering a multitude of topics, including COVID-19 risk perception at work. The survey was carried out in June, so at a time when the incidence rate was very low in Austria, as background information. Health risk is often conceptualized as the probability of catching a disease multiplied by the magnitude of the consequences of catching the disease. In our study, we focus on the first dimension, so asking respondents how high they estimate the risk that they will get infected with the coronavirus at work, using a 4-point response scale. So we find a rather similar level overall for women and men. So about a quarter of women and men perceive the risk of contracting the coronavirus at work as very high or high. Differentiated by sector of activity, we identify 3 high-risk sectors and 3 low-risk sectors. So in education, the highest risk sector, around 46% of employees estimate their infection risk as high, followed by those working in the health and care sector with almost 40%, and followed by sales and retail workers with 35%. At the other end, we find 3 sectors with low perceived risks of infection. These include construction, ICT, and manufacturing. So it's noteworthy that in the high-risk sectors, women make up the vast majority of the workforce. Like more than 70% of education, health, and care workers are women, whereas the low-risk sectors are male-dominated. So although the focus of this study is on gender and occupation, Raya told me that this is a demography conference, so we definitely have to show some numbers by education and age. So very briefly, the perceived risk barely varies with education. In a multivariate regression model, education turns out non-significant, actually. So what matters much more than the qualification level of workers is the sector they work in and their age.
Sorry, so Nadia, 2 more minutes, please.
Yeah. So age matters a lot. Those aged 40 to 59 perceive the comparatively lowest risk, and this remains once we control for education, sector of activity. It remains once we control for home office use, the size of firms, weekly working hours, and so on and so forth. So it's quite robust. A potential reason is maybe that during the pandemic, employers put the younger ones, the younger employees at the front line much more than older individuals. But that's, of course, rather speculative. Right, so migrant background also matters a lot. So less than 30% of native Austrians perceive a high risk compared to more than 50% of workers born outside the EU 15. So that's a stark gradient. Now, are women now more exposed to the coronavirus at work compared to men? To find out, we ran a set of analysis on women's and men's risk perception, trying to tease out the role played by the type of work that women and men do. So in the first analysis, we modeled the association of gender with the perceived risk based on ordinal logistic regression models. In a base model, we control just for education, age, household type, NUTS2 region, and country of birth. And in a base model, we don't find a significant gender difference. Once we control for weekly working hours, a significant gender difference is borne out. It's not large. It amounts to about a difference of 6 percentage points. And once we control for other things at the workplace, such as firm size, home office use, and so on and so forth, this gender difference stays rather stable. Only when we control for the sector of activity, which we may argue to reflect the actual hazard of becoming infected with the coronavirus at work, the gender difference is minimized, so rendered non-significant. So our tentative conclusion from this mediation analysis is that the gender difference that is revealed in the second model, which controls for working hours, is not driven by gender per se. Rather, it's about the type of work that women and men do. A similar conclusion may be based on this analysis, which differentiates the average risk perception not by sector, but by the gender composition of workplaces. So we asked people if at their workplace they are mostly surrounded by men or mostly by women, or if there is good gender balance. And it turns out that the higher the share of women at the workplace, the higher the perceived risk. And this is true for both women and men working in these workplaces. And finally, for a more direct test of the hypothesis, maybe that there is no gender difference in risk perception once we hold the actual hazard constant. So we differentiate the sectors into low risk, medium risk, and high risk, as I've shown before. So this depends on the average level of risk perception among the male and the female workforce. And then we look at gender differences in risk perception within these three risk levels, to the effect that in either of them we find a significant gender difference. So maybe in the low risk sectors, women perceive a somewhat higher risk than men, but it's not statistically significant, and substantially can probably be explained by the fact that in these sectors, in these male dominated sectors, women's and men's jobs are potentially most dissimilar as compared to the other risk levels. Okay, so in terms of conclusion, we found that in some sectors, the perceived risk of infection tends to be rather high. So between 35 and 46% of workers in these sectors feel that their risk of contracting COVID at work is high, even though we collected these data during a low incidence period. So it's surprisingly high figures, I would think. Workers with migrant background tend to perceive a particularly high risk, which is plausibly also due to the kind of jobs and work environments that migrant workers face. The risk was perceived to be highest in female-dominated essential industries, but by both women and men alike. So men and women in comparable jobs and work environments tend to perceive a similar risk of infection. Women don't worry more than men due to their gender. It appears they worry more when their cognitive risk assessment correctly indicates that the risk at work is objectively higher. Okay, I'm gonna stop here in terms of conclusion. Thanks a lot.